Time for the KBOI Medical Moment, brought to you by Regence Blue Shield of Idaho, featuring Dr. Mark Hiatt, the Executive Medical Director for Regence. Dr. Hiatt, good morning.
Good morning, Chris and Paul J.
Health risks following Hurricane Harvey. Now, they're showing the sun is out. The floodwaters are just mud in some places. But, man, there's a mess that has to be cleaned up. What lies ahead?
Oh, Paul J., there's certainly a mess. When you think of floodwater, it's more than just simple rain. It's often contaminated with sewage and chemicals. It can hide sharp objects made of metal or glass. It can carry disease. Now, the most common disease carried is diarrhea or other stomach problems if people come in contact with that contaminated water or consume food or drink that has.
Doctor, what about items that have been contaminated with floodwater?
Chris, using items that have been submerged in that water can also cause stomach problems. So, for example, parents should be very careful about letting their children play with toys that may not have been cleaned that had been in that water.
Any other health risks besides the stomach problems?
Yeah, a lot more than just gastrointestinal. Exposure to that contaminated floodwater can increase the risk for skin rashes, ear, nose, and throat problems, and conjunctivitis.
Any other source of infection at this time besides, directly from the floodwater? Are there other things you have to worry about while traversing through Houston?
Definitely. With so many people after the storm staying close together in shelters with large groups, you can imagine it's very easy to spread germs. And so that occasional stomach bug or respiratory infection may actually more likely result from people having to stay in close quarters with these large groups. And you have to remember, with a flood, it's very hard for people to keep up their usual good hygiene.
Doctor, what can these people do the people who are in close quarters? What can they do to be safe?
Because those people staying in the shelters with large groups of people should be really careful to wash their hands to prevent that spread of any disease. And then also any people with wounds, with open wounds, need to take care to keep them covered, because that contaminated floodwater can easily cause a wound to become infected.
Okay, after the floodwaters go down, what are the other concerns with cleanup?
Well, Paul J., these concerns will linger on even after the floodwaters have receded. Doctors, in fact, often see more patients with respiratory infections after the floodwaters recede and people are allowed to return to their homes, because you can think of all the contamination from the floodwaters and all the mold that quickly grows in that warm, moist, humid environment in Texas. You can think of all of that really causing people's asthma to be worse and triggering their allergies.
Do you have any recommendations for how people should be cleaning up?
We're using lots of soap and water and disinfectant. And so walls, floors, and anything with a hard surface that has come in contact with floodwater really needs to be cleaned thoroughly. The fabrics, of course, should be washed. Furniture should be dried out in the sun and then sprayed with a disinfectant. Carpets need to be steam cleaned. And needless to say, Chris, that any food, beverage, and medicine that has come in contact with the contaminated water needs to be thrown away.
And are there health risks other than physical ones?
Absolutely. It could be that the greatest risks are not physical, but rather mental. The biggest challenge from flooding may really be the mental, with at least a temporary increase in stress, anxiety, and depression. These brave Texans have endured so much, and they really have lost so much. And so mental challenges may be among the greatest.
And we're getting ready for another hurricane to hit down in Florida right after this. Wow. So we'll have to watch all of that.
Yes.
Doctor, thank you very much for joining us this morning. We appreciate it.
Thank you.
Thanks, Doc.
It's been the KBOI Medical Moment, brought to you by Regence Blue Shield of Idaho, featuring Dr. Mark Hiatt, the Executive Medical Director for Regence.